right, good afternoon, everybody. How's everybody doing? It's a great conference. I'm so honored to be here, and thank you so much for that kind introduction and the invitation, Dr. Helsner. So I will be speaking today on our experience at New York City Health and Hospitals in the plant-based lifestyle medicine space. Start by letting you know I have no financial disclosures, but because I will be discussing food, I am forced to let you know that I'm all about my veggies. Today I'm hoping that through this conversation you'll come to understand a little bit more about the mission, the structure, and the outcomes at our Bellevue plant-based program, that together we'll sort of discuss some of the benefits of using a plant-based lifestyle medicine approach for not just preventing but actually treating cardiometabolic disease, and I'm sure you've already heard some of that today. And finally, we'll explore some of the goals and challenges in expanding lifestyle medicine throughout traditional health systems. So I want to take you back to September 2017, the steps of City Hall. I'm sure you recognize at least a couple of people here. And this is where an idea took root. And this idea was really inspired by the health journey of none other than Eric Adams, then Brooklyn Borough President, and now the Mayor of New York City. As most of you know, he had been diagnosed with type 2 diabetes, and very elevated blood sugar. He also had many symptoms. And he was told there's not much you can do other than take insulin and some pills. So he did some research on his own, and he learned about a plant-based lifestyle. He started enacting that lifestyle, and here today, Mayor Adams has put his type 2 diabetes into remission, which I can tell you is one of the most remarkable things that I've seen as a physician. When I've seen this in my patients, it's one of the best feelings you can ever have, not to mention how good it must feel for the patient. So the idea was, let's give all New Yorkers that support that they need to get healthy using a plant-based lifestyle medicine approach. Let's get medical teams that know about this, that can help support our patients in doing this so that they don't have to necessarily just go out and do their own research and not have any support. So what exactly is this term, lifestyle medicine? What does that mean? Well, it's really an evidence-based approach to preventing, treating, and in some cases even reversing lifestyle-related conditions through the adoption of healthy behaviors. And we can think about it in these 6 different pillars. So there's healthy eating, there's physical activity, there's stress management, which we heard a lot about today from Dr. Batiste, and I would fold resilience into that. There's forming positive relationships and social connections. There's improving sleep. How many people here have thought about, I should probably sleep a little bit more? Right? And we've seen that too in our patients in the Bellevue program. Sometimes we want to talk about plants, but we realize the person's not sleeping. And sometimes that's way upstream, and that's one of the first lifestyle pillars that we address. And it's of course about avoiding risky substances like tobacco. Now, of all these pillars, when you look at the science around lifestyle medicine, probably what we eat has the biggest impact. It's probably the most important because we know that a suboptimal diet is actually the #1 risk factor for dying of a chronic disease. Not just in the United States, but actually globally. But it's very powerful when you put numerous lifestyle habits together. So I think this is probably one of the best titles for a study that I've ever seen. And this is a very large prospective cohort study in which the researchers identified these 4 factors, which were never smoking, exercising 3.5 hours a week, eating a healthy diet, and having a body mass index less than 30. So the first 3 are directly lifestyle habits. And what they found is that the combination of all 4 of these factors was linked to a 78% lower risk of having any one of these outcomes. Type 2 diabetes, myocardial infarction, which means heart attack, stroke, and cancer. 78% lower risk. That's amazing. So this is just to show sort of the power of when we put all of these healthy pillars together, what kinds of benefits we can have. And what about if it runs in your family? What if you have a high genetic risk? Oh, heart disease has been in my family as far back as I know, or cancer's in my family as far back as I know, or like so many of my patients who come to me and say, my mom has diabetes, my dad has diabetes, my brother has diabetes, obviously I'm gonna get diabetes. And the truth is that lifestyle can still play an enormous role. This is a study looking at individuals at high genetic risk for coronary heart disease. And what they found is that among participants that were at a high risk, a favorable lifestyle was linked to a 50% lower risk of coronary artery disease compared to an unfavorable lifestyle. So there's so much we can do with the lifestyle habits that we have. And this is why major medical societies all emphasize the role of lifestyle as really the foundation. So whether that's for diabetes prevention or treatment, whether that's for cardiovascular risk reduction, or whether that's for cancer prevention and survivorship, they all unify around a healthy lifestyle. So why plant-based? In case you just walked into this conference right now. And what is a plant-based diet, in case you really are just walking in now? Well, a plant-based diet is essentially a diet that's very rich in all kinds of fruits and vegetables, as well as proteins from plant sources like legumes, healthy plant fats such as nuts, seeds, avocados, and of course whole grains, my personal favorite, oats, brown rice, quinoa. And it's really putting all of these foods on the plate. It doesn't have to necessarily be 100%, but we know the farther that people go on this spectrum of moving towards a plant-based diet, the better. If I have a patient that comes into my office and is starting out 20% plant-based and they move to 60, that's a huge win. And we're, of course, there to support them to go as far as they want and can. So what are the benefits that you can see? Well, these are just some of the scientific, summary of the scientific literature. So across the board, very consistently, interestingly, in the epidemiologic research, you can see about a 25% reduction in the risk of coronary heart disease with a plant-based diet. You can see improvements in blood pressure. You can see significant reductions in your LDL cholesterol, a huge decrease in the risk of type 2 diabetes, of course, improved blood sugar control if you already have diabetes, and in some cases, even remission, just like we know with our mayor, decreased incidence and progression of chronic kidney disease, as Dr. Joshi can attest, healthy weight management, and a lower cancer risk. I mean, come on. Lots to love. So how did we take this idea and put it into practice? So together with Mayor Adams, then Brooklyn Borough President, the Mayor's Office, and New York City Health and Hospitals, we were able to launch the Bellevue Plant-Based Lifestyle Medicine Program in 2019. And our mission there was to provide intensive support for these evidence-based lifestyle changes. We really also wanted to reach communities that were at a disproportionate burden of cardiometabolic disease. Communities that are facing the highest burden of hypertension, of type 2 diabetes, and who are also at the same time facing the biggest barriers structurally to actually making lifestyle changes in the first place, the folks who really could benefit the most from our support. And I'm very proud to say that our program was the first of its kind in any public healthcare system in the country. Now, Bellevue has had a lot of firsts. It was actually the first hospital in the United States that's still running. It had the first maternity ward, it had the first ambulance, it had the first combined children's school and TB sanatorium. We cured and treated Ebola. So we figured, if we can do all these things, like curing Ebola, we could probably help people eat more broccoli. All right, so let me tell you a little bit about the context at Bellevue. Of course, again, this is a public hospital that serves all New Yorkers, regardless of their ability to pay. About 68% of our patients either have Medicaid or have no insurance at all. We have a very large immigrant population. It's very ethnically diverse, and a significant proportion of our visits are conducted in languages other than English. So as my team can attest, especially in primary care, in a given week, you will use an interpreter to speak any number of these languages, and then some. So for our program, we selected really the cardiometabolic conditions as our eligibility criteria. So adults that have type 2 diabetes, prediabetes, hypertension, atherosclerotic cardiovascular disease, or health concerns related to obesity. And we got referrals in two different ways. The first is through internal e-consult referrals. That means providers within the health and hospital system can actually refer patients directly to us. That launched last year. And from the beginning, we've had this capacity to have individuals in the community self-refer. And that was really important to us because we knew that maybe not all physicians or other practitioners out there would be familiar with plant-based lifestyle medicine or even lifestyle medicine in general. So we wanted to put the power in individuals' hands to be able to seek the support that they needed. And boy, did they seek it. So this is our contact center team dedicated number that we had to develop because we had so many calls. We said we need our own hotline. We need a broccoli hotline. So this is our interdisciplinary team sitting conveniently right here in a row. We're just missing one of them. So that's really our secret sauce. So we have 4 physicians, and they're working part-time at 0.1 FTE each. We have a full-time registered dietitian, Lily Correa. We have a certified health coach, Chris-Ann Polito-Muller. We have an exercise trainer who's not here today, our program coordinator, who's also not here, our fabulous, fabulous volunteer, John Babich, and of course, I include the PCP here. Sometimes we're the PCP, the primary care physician, for the patients we see in our program, but in most cases, our patients have an outside PCP. And it's really great for us to collaborate. We sort of see ourselves as physicians as co-managing our patients' chronic conditions along with their PCP. We just focus on the lifestyle part. So if I'm seeing a patient that has type 2 diabetes, like I saw the other day, and she's on a medication that rapidly lowers blood sugar, a type of sulfonylurea, and her A1C is coming down, her sugars are going way down, I will decrease her medication or stop it, and I'll call her PCP and say, hey, your patient's doing so well, we're able to decrease this medication. I just wanted to let you know, it's for her safety. Similarly, I had a patient last month who came to me super motivated to change his diet. And I looked over his medication list, and he's taking an anticoagulant called warfarin, where you don't have to limit, but you have to be very consistent about your intake of vitamin K-rich vegetables and foods. So as we were telling him, we really want to have you eat more vegetables, more leafy greens, he was like, oh, I can't do that. And I said, well, it's true, it's a little trickier. Let me talk to your PCP. And I spoke to his PCP. He had non-valvular atrial fibrillation, and he was actually a candidate for being on an alternative medication called a DOAC that does not have any interaction with food. And so now he's eating all the vegetables that he wants without any concern for his blood levels of his anticoagulation. So this is just an example of our collaboration. Now, our patients flow through the program. We have an active phase and a support phase. So in the active phase, our patients have 2 to 3 visits with each clinical member. So with the physician, with our dietitian, and the health coach. And then they have 22 weekly group sessions through video. 14 of which are what we call our Lifestyle Starter Series, which is led by Lily and Chris-Ann, our dietitian and health coach, that goes through the pillars, education around the different pillars of lifestyle medicine, and then 8 exercise classes. We have the ability to give out resources to our patients, including plant-based cookbooks, resistance bands for exercise training, and our starter guide to a plant-based diet that we developed. We have an amazing private Facebook page. And this is where folks, patients in our program who decide to sign up for the Facebook group actually can post their meal prep, they post their recipes, they give each other support. We have recordings of our group session without patients present, of course, for HIPAA. For individuals who want to go back and watch the recordings, it's just a wonderful space. And we have a lot of check-ins through MyChart. And then in the support phase, we have a monthly video group support. That's both in English and Spanish. We still have that Facebook page, and we have individual visits as needed. So these are just the topics that are included in our Lifestyle Starter Series. So you can see that they cover the gamut from the introduction to the plant-powered plate, label reading, recipe makeovers, fitness fundamentals, mindful eating, stress management, sleep health. It's really very comprehensive. This is Lily and Chrisanne at one of our live cooking demos before the pandemic, where they made tempeh tacos. It was a huge success, and actually, not only were the patients really excited about it, but we had a lot of staff at Bellevue walking by and kind of coming in and sitting in on the cooking demo, so that was really fun. And this is a screenshot of our starter guide to a plant-based diet that we developed, which is also available in Spanish. This is a picture of one of the sort of nutritional foundations of our program, which has to do with what we call the plant-powered plate. And what we like to do when we speak to patients about transitioning to a plant-based diet is not just to increase and sort of crowd out, use plant foods to crowd out other things on the plate, but also achieve balance on the plate between different types of plant foods. So it's kind of a reworking of the traditional My Plate model, but in plant-based form. So where you can see here that half of the plate is filled with those non-starchy vegetables, emphasizing whichever ones the patient happens to like. A quarter of the plate can be a starchy vegetable or a whole grain, and a quarter of the plate is usually a plant source of protein like lentils or beans or tofu. And then of course, you can add your whole food fat sources as dressings or condiments. Our approach to lifestyle change with our patients, I think first and foremost, we all recognize that we want to understand why is the patient in our program. What do they ultimately want to achieve? What's their vision? Is it that they want to get healthier so that they can feel better and have more energy? Is it to be there for their grandkids' high school graduation? What is it that is really making them click to want to make these changes? So we can use that as an anchor throughout their process in the program. We do a lot of very patient-centered action planning. So that really looks like talking to someone about, not me telling you, I want you to go home and eat more broccoli. That's not how it works. It's more like, tell me about your life. Tell me about what foods you like. And how can you start incorporating these more in your diet? How can you set a very specific plan? And I'll help you adjust that. We, of course, tailor to everyone's cultural background, to their family situation, to their socioeconomic status. We pay a lot of attention to our patients' social needs, which can affect their ability to make these changes. And as I alluded to before, we are huge cheerleaders. I mean, we will literally celebrate any movement towards a healthier lifestyle so that people come in and they feel good. I mean, it's hard. It's hard to change your lifestyle. So why not celebrate the small changes so people can feel more excited and more empowered to keep going? Now the boring stuff, billing. So physician visits in our program occur within our primary care center, so they're billed as if they were any other primary care visit. That's not been an issue. Dietitian visits are covered by some insurances and certain conditions, but otherwise the insurance coverage we've found has definitely tended to be variable. Our health coach visits are non-billable. So for our outcomes, I said before that we had a lot of interest. So to date, we've actually now had almost 1,000 individuals sign up on a waiting list to join our program from New York City. And they're still coming. And we have internally, since we set up our e-consult system, nearly 500 referrals from our own hospital system. And we've treated about 400 patients, including the fact that we had to take almost a year off with the pandemic. We had an external program evaluation from an NYU team that looked at health behaviors and clinical outcomes. And what they found is that our patients are making significant improvements in their health behaviors, including big improvements in their diet quality, moving towards a more plant-based diet, increased physical activity, and better sleep health. And not surprisingly, we've seen very promising early clinical outcomes, including weight loss in our patients, in those who are obese or overweight, improvements in blood pressure, and improvements in blood sugar control in people with type 2 diabetes, and great patient satisfaction, which we love to see. So 2 months ago, Rachel Atchison mentioned that 2 months ago we had a great announcement of partnership with support from the mayor's office and health and hospitals in expanding the Bellevue model to 6 new sites covering all 5 boroughs of New York City. So these are our new sites. We have the original program at Bellevue. We go up to the Bronx. We have Lincoln and Jacoby that are going to have programs. In Queens, we have Elmhurst. In Brooklyn, we have Woodhull and Kings County right across the street. And then in Staten Island, we're going to have the Gotham Vanderbilt clinic site. So we're extremely excited about that. So all of the new sites are going to be based on the original Bellevue program model, but with some key upgrades. So first of all, we realized that we really needed a partnership with behavioral health. So we were seeing so many patients that were experiencing depression, anxiety, disordered eating, and things that really, things that patients I think would really benefit from therapy or other kinds of treatment for these conditions that we were not necessarily able to offer. So we're gonna have a wonderful collaboration with our licensed clinical social workers and psychiatry team. Number two, community health workers. We are so excited about this. So our community health workers, Bellevue and Health and Hospitals already has a really robust CHW program, and we're gonna have 2 community health workers at every single site, and the CHWs are gonna be the bridge between what we're working with patients on in the clinics and in the groups to the patient's home and community. So we'll be able to go shopping with our patients, grocery shopping. They'll be able to help them work out the details around meal prep. They'll be able to say, okay, so how can we get some movement into your day? What's going on in your apartment where we can work out a way for you to get more movement into your life? And really help also address our patients' social needs. Help us continue to screen for food insecurity, help our patients get food when they need it. Make referrals around housing and other issues that our patients may be having that make it really hard to make lifestyle changes. We are going to hire nurse practitioners to join our dietitian and health coach team to turn our group classes into shared medical appointments. And that's really for financial sustainability because these are billable visits. And this is how most lifestyle medicine programs are conducting group visits now. And finally, we're gonna have produce deliveries for our patients from New York farmers. So we're super excited about all of that. We're also going to train all of the new clinical staff that we hire with a partnership with the American College of Lifestyle Medicine. We're going to have the ability to use their lifestyle medicine board review course for training all of our new staff, as well as a couple of their online nutrition courses. We're going to create, in partnership with an organization, to create a culinary medicine course for our staff so that they can actually take the nutrition science to the kitchen and have practical approaches with our patients. And finally, everyone will get a lot of hands-on training from our own nutrition and lifestyle medicine team. So what are some of the challenges and opportunities that we have moving forward? Well, first, I think it's, I want to say that I think it's, it's not, we have to think about what it's like to treat a very diverse patient population. So we have people coming from all walks of life, from all cultural backgrounds, different levels of literacy, different levels of health literacy, and we really need to figure out what is the best way to scale a program like this when you're treating patients from such different backgrounds. And so that's one of the things that we're going to continue to explore, as well as the digital divide, because we know that since we're running a lot of our sessions on video, that can be very hard for some patients. We've definitely seen there are individuals who struggle in terms of their computer literacy to be able to attend a session online. And so we really want to figure out how to address that and probably have a hybrid with in-person sessions as well. We want to partner with community-based organizations and faith-based organizations to reach more communities in need. We want to strengthen our capacity to meet our patients' social needs and train more providers in lifestyle medicine because we really need, there's such a demand by the public, we really need to get more people trained. And finally, we would really like to advocate for more payer coverage of lifestyle medicine services, especially our dietitian visits. And I encourage everyone here to write to your representatives to support the Medical Nutrition Act, which has been before Congress now for a few years. This is an act that would really expand the number of conditions for which Medicare would pay for a dietitian visit, and it's so overdue. So please do support that. So I'll finish with a testimonial from one of our patients who was in our program from the beginning, and he said, since starting the program 4 months ago, I've lost 18 pounds, lowered my blood pressure, lowered my triglycerides, and reduced my blood sugar. The program is nothing short of life-saving. I hope it can continue to be offered to more New Yorkers. So do I, and that's our goal. Thank you.